Well, if you are living with persistent pain or recovering from an injury, there's a medical specialty that can make a real difference in your life without surgery. Here to tell us all about it is Dr. Patrick Siegele, a physical medicine and rehabilitation doctor at Gaylord Specialty Healthcare. He's here to talk about these non-surgical treatments like regenerative medicine, doctor. There's a lot of developments in all of this. First of all, thanks for being here.
Thank you, Natasha.
I want to start with your specialty. Tell us what it is that you focus on.
Yeah, so physical medicine and rehabilitation, also known as physiatry. We're experts of conditions of the brain, spinal cord, musculoskeletal system, particularly on the outpatient side. My area of interest is musculoskeletal issues, non-surgical treatments of joint pain, tendon issues. So kind of a broad spectrum of things. Mostly that musculoskeletal piece is what I'm most interested in.
Yeah, and I think a lot of people may be listening who do have persistent pain recovering from an injury. Hearing that there are non-surgical options would make them feel relief. So let's talk about this regenerative medicine, what it's all about.
Yeah, so I guess we have a large toolkit of treatments. So therapies, different types of bracing, orthotics, ultrasound-guided injections with steroid, hyaluronic acid, and then the regenerative medicines are some of the newer treatment options. One of them specifically that we have at the Gaylord Clinic is, it's called platelet-rich plasma, or PRP, and basically what that entails is a patient comes in, we do a simple blood draw, spin the blood down in a centrifuge, and then we take off that platelet-rich layer, which is now concentrated all the growth factors in the blood. And then we'll inject that back with the ultrasound machine precisely into the joint, into the tendon, the muscle, kind of wherever the pathology is. To help, and basically the goal is you inject that high concentration of growth factors into the area to stimulate the body's own natural repair mechanisms.
Wow, that is amazing. And in most cases, how long does it take for people to feel results from something like that?
So people start to notice, within a few weeks, they start to notice improvements, with full effects taking a few months.
So PRP, who is a candidate for something like that?
Yeah, it's kind of a wide variety of patients. Joint arthritis, osteoarthritis is one of the main patients we work with, but then also patients with rotator cuff pathology, tennis elbow, golfer's elbow, bursitis, Achilles tendinopathy, plantar fasciitis, so kind of some of the chronic like aches and pains,
sure,
lingering joint pains.
And I'm so sure you've seen success stories with people who have pain that took so long to find a solution to. What is that like for you to see those people feel relief?
Yeah, it's great when you can offer someone kind of a quicker path to recovery. And then the great thing too about the regenerative medicine options is after we do the injections, we send people directly off to therapy with a specific protocol of how to load the joint, how to load the tendon. Tendons actually need that load to heal, so it's kind of a very regimented way that we're going to be loading the tendon after the procedure to get them up and running quickly. So there's not the long downtime or
sure,
period of immobility afterwards.
Yeah, that is certainly a great option for people. So getting started, do people need any sort of referral to come to you guys for an evaluation?
No referral needed. They can go to the Gaylord website, gaylord.org/PRP, or give the outpatient office a call, and we'll get them in to see them.
Wonderful. Well, doctor, thank you so much for teaching us a bit more about all of this. It's incredible work that you guys do. Thank you.
All right, thanks.
And if you guys would like to learn more, there's the number on your screen. If you would like to call for an evaluation, we will also have all of those details for you on WTNH.com.